We're going to continue on with our discussion of central nervous system disorders, but now rather than focusing on disorders of the brain, I want to look at what can happen to the body when the spinal cord or the vertebral column becomes damaged. And the first thing I'm going to talk about is spinal cord trauma. This usually will occur if a person has some sort of a accident, such as a car accident, or they fall forward or backwards, and this can cause either hyperflexion of their back, either in the neck or the lumbar area or thoracic area, wherever it might be, or it can cause hyperextension, hyperflexion, or you can get some sort of a rotational damage to the vertebral column that causes partial or complete tearing or severing of the spinal cord. Now, you'll remember from Bio 201 that we have these things in our body called dermatomes. And dermatomes, simply put, are the areas of the skin and underlying dermis which are innervated by a particular spinal nerve. So if we look at this guy here, you can see that the areas of the body that are highlighted in pink are the ones that are innervated by the spinal nerves in the cervical vertebra. The area shaded in purple here represents the areas of the body that are innervated by the thoracic spinal nerves. The areas in green represent the portions of the body that are innervated by the lumbar spinal nerves, and then the sacral, et cetera, et cetera. So the reason I bring this up is that the types of symptoms, signs and symptoms a patient has is directly reflective of the level at which the spinal cord was damaged. So, for example, if somebody has a car accident and they're damaged at L1 to L2, and the spinal cord is severed between L1 and L2, well, then we know that they're going to have loss of function in pretty much all the areas outlined in green, and everything below that point. So at that point, they're not going to be receiving sensory information incoming from those regions, and they will have no ability to control outgoing motor commands for that region. If the person, on the other hand, let's say, had their C5 vertebra damage, then everything from this point downward, including all of the thoracic region, their legs, and most of their shoulders and arms would be involved and implicated in loss of sensory and motor control. If I have the entire spinal cord severed completely, that's called a complete spinal cord injury. If, on the other hand, only part of the spinal cord is damaged and the remainder of it is intact, we have incomplete spinal damage, and that may explain why a person could have, say, loss of sensation and movement in their left leg, but not their right leg, depending on how the injury occurred. If a person loses all ability to control both their arms and both their legs, that's called quadriplegia. If, on the other hand, they have only lost their ability to control their legs, that's paraplegia. And that's really all I'm going to talk about with relationship to spinal cord injuries. Now I want to look at vertebral column injuries. A lot of times you can damage the vertebral column and have a much lesser permanent impact on the spinal cord. In some cases, if you don't correct the vertebral column injury, you can eventually cause permanent damage to the spinal cord or spinal nerves, but oftentimes, as long as corrective measures are taken, these vertebral column injuries will not result in permanent nerve damage. And I'm going to go over a number of different types of vertebral column injuries. I'm going to go over them very briefly because I'm also going to include this week an interview with Dr. Jim Henriksen, who's my husband. He's also been a chiropractor for nearly 30 years, and he's extremely knowledgeable about all of these conditions. And so I'm going to let him do most of the talking. All I'm going to do over the next few slides is give you the basics of what each of these diseases are, so that when you listen to my interview with him, it will make sense to you, hopefully. So we're going to tackle very briefly degenerative disc diseases, spondylolysis, spondylolisthesis, spinal stenosis, and sciatica. So the first one I want to talk about is a collection of diseases called degenerative disc disease. And all of these center around problems with the intervertebral disc, either breaking down or rupturing in one way or another. And you'll remember that between our vertebra, here's, for example, one vertebra in cross-section, here's another, that we have a layer of cushioning between each pair of vertebra, and that's called the vertebral disc or the intervertebral disc. And it is made up of fibrocartilage plus a kind of gel-like substance. And the two parts of the intervertebral disc include this gel-like substance in the center area, and that gel-like substance is called the nucleus pulposus. And then the outer part is the fibrocartilage part. That's the thing here that looks almost like layers of an onion. That is the fibrocartilage, and it is called the annulus fibrosus, which literally means fiber-like rings. Annulus is a ring, okay, or a circle. And as long as the intervertebral disc is intact and proper thickness, you have no problem. You have good cushioning between your vertebra, everything's spaced properly, spinal nerves have the room they need so that they don't get pinched and cause discomfort. But if something were to happen and the annulus fibrosus were to break down, or tear, for example, during some, like, let's say you strain your back or pull your back lifting something really heavy, you can tear that annulus fibrosus, and eventually, if it's a bad enough injury, you can have the gel-like nucleus pulposus leak out, and that would be called a herniated disc, and that can be very painful because if you remember the structure of your vertebra in relationship to your spinal cord, here's the spinal cord. Here are your spinal nerves radiating out from the spinal cord. And if I suddenly have a big bulge of gel-like material issuing out the side of the herniated disc, that will put pressure on this spinal nerve right here, and it can cause all kinds of different symptoms and pains that Jim's going to talk about to you in the podcast. So good enough on that. I'm going to move on and talk about next very quickly what exactly spondylolysis is. So spondylolysis is a condition that involves a defect with a particular location on the spinous process of a vertebra. Now if we look here, just to remind you again, here's a side view of the lumbar vertebra of an individual, and you can see that this is the anterior part here, this is the posterior here, that we have this secondary curvature. You'll remember that developed when you first learned how to walk, that secondary curvature in the lumbar area. Here's the body of the vertebra, and you'll remember there's this thing off the back called the spinous process that juts out. One of the big reasons the spinous process is there for is to help prevent the sliding forward of these vertebra due to the force of gravity and just natural weight pulling it forward. They help to sort of lock the vertebra into place and prevent that sliding sensation. Now, if a person has a defect or a fracture or a break in a region in that spinous process, it can cause problems of slippage. And the primary place where that defect can develop is in a region called the pars interarticularis. The pars interarticularis is simply a region of the spinous process that tends to fuse into bone later in life, and so as a result, in younger kids, it's susceptible to stress fracture because it's not fully fused bone there yet. And so, indeed, spondylolysis, this defect or minor fracture in the pars interarticularis, is commonly seen in children and teens who are athletes. For example, those playing tennis or diving or gymnastics, football players actually too can get it as well. And this condition, just the simple fracture itself of the pars interarticularis, is called spondylolysis. And depending on the severity of it, you might use a watch and wait approach with the patient. Only in about 10% of cases do they actually go in and do some sort of surgery to correct it. Here's a picture here showing you a very severe spondylolysis where the spinous process has completely separated. Now, once I get this defect of the pars interarticularis as I said before, the reason the spinous process is there is to prevent slipping forward. If slipping forward begins to occur, like we see over here where this vertebra is now slipping forward, then we have a condition called spondylolisthesis. So spondylolisthesis is a progression of spondylolysis. Now, I want to say one thing real quick here. Particularly in older people, you don't have to have spondylolysis first in order to get spondylolisthesis. But it's very often the case that you'll start with spondylolysis and then progress to spondylolisthesis. Now, look at this slide here, and you can see quite clearly on this X-ray where there's been movement of the L4 vertebral body when compared to where the L5 vertebral body is. This is spondylolisthesis, and it looks to me to be about roughly a grade 2. They grade spondylolisthesia based on how much slippage has occurred. So here's a normal spine with everything nice and proper alignment. If we get just a little slippage outward, less than 25% of the vertebral body has been displaced from its normal alignment, that's called grade 1. If 25 to 50% of the vertebral body has been displaced, then it's grade 2. 50 to 75% of the vertebral body has moved would be grade 3. And if it's completely 100% or 75% or more of the vertebral body has moved out of place, then you have a grade 4. And again, we'll hear more about the signs and symptoms, et cetera, associated with this when we talk with Dr. Jim. Spinal stenosis is another condition that can be very painful for patients, and it can sometimes be a result of spondylolisthesis. It can sometimes be a result of a bulging disc. It can sometimes be a result of other types of abnormalities of the spinal cord. What spinal stenosis means is narrowing. Stenosis means to narrow. And what this is referring to, spinal stenosis, is a narrowing down of the space in which the spinal column travels in the vertebral foramen of the vertebra. And so if I do anything that causes bulging inward, for example, into that space where the spinal column runs, I can get pinching on the spinal column or pinching on the spinal nerves that radiate out of the spinal column at that vertebra. And this can cause a number of different painful experiences for patients that we'll learn about on the podcast. So spinal stenosis, again, it can happen for a number of different reasons. It can impact just one spinal nerve. It can impact both depending on the placement of the bulge. And if we were to look at it, say in this picture here, you can see here's an example where we had a bulging or herniated disc and it's pushing in on the spinal cord. I'll erase my drawing there so you can see it a little better. It's pushing in on the spinal cord at this location and causing temporary nerve damage, which, if it is not fixed, could eventually progress to permanent nerve damage. The last condition I'm going to very briefly discuss so that you'll know what we're talking about in the podcast interview is sciatica. And this is a really common condition. Sciatica is a very common conglomeration of symptoms that's associated with irritation, pinching, or compression of some sort of the sciatic nerve. And I just want to remind you that the sciatic nerve is composed of a number of different spinal nerves which all come together. Okay, so for example, you have the S1 nerve, the L5, L4, and L3. All are portions of the sciatic nerve that join together. They pass out through the greater sciatic notch here and down by the anterior portion of the pelvis and down the leg. And depending on which of the spinal nerve roots is nearest to the point of irritation, whatever that irritation might be, will determine the pain sensations and the locations of those pain sensations that the person feels. So you can see, for example, in S1 root pain, these areas in black on the posterior sides of the leg would be the more common locations for the sciatica. Whereas if it were L3, for example, the patient patient would experience sensations of pain or numbness on the anterior part of the thigh. And you get intermediates for L5 and L4 that include both the thigh and the lower leg. We'll learn more about the kinds of irritants that can cause the pain of sciatica and a little bit more about the different types of symptoms of sciatica in the podcast.